So, well, let's maybe have a think about the sort of things that can cause these sort of chronic inflammation.
Even better.
Yeah. So, as with acute hepatitis, viruses can also cause chronic liver disease, chronic hepatitis. Hepatitis C, the one that we haven't mentioned yet, is worldwide is a common cause of chronic liver inflammation. Hepatitis C is quite a devious virus.
It seems to be all viruses are devious these days.
Yeah, that's true.
Look, we're our minds are constantly on COVID and all sorts of variations of the H1N1 and it's and things. All I'm getting from the world of viruses is that they're all devious.
They are all devious. That is very, very true. But, fortunately, a lot of them your body can get rid of pretty quickly. But hepatitis C is not like that. It's it's an undercover virus. So hepatitis C, it's normally passed on by blood. So things like dirty needles or unscreened transfusion products, things like this. And unlike hepatitis A and indeed hepatitis B, you often don't know if you've had an acute infection with hepatitis C. It doesn't often make you feel unwell. It doesn't often cause jaundice. You don't really know about it. But over 70% of people who get infected with hepatitis C, the virus will evade your immune system, your body won't get rid of it, and it'll take up permanent residence in your blood and in your liver. And you won't know about it because you won't feel anything, but, year after year after year, that unwelcome guest in your liver will cause this ongoing liver inflammation, it'll cause scarring, and, worldwide, hepatitis C is a major cause of liver cirrhosis, and also liver cancer, which I guess we'll talk about as well in a bit. So hepatitis C is an important one. Hepatitis B, which we mentioned earlier, causes an acute hepatitis. It often causes jaundice and, a few weeks of infection. In about 10 or 15% of people.
Oh, that's a lot.
Get it. It's not as bad as 70%.
No, but I'm just thinking 10%. Like I always grade it. If you're going somewhere and they say, "Hey, we're going to give you a 10% discount on that," it's like, "Hey, I'll take a 10% discount." So I'm thinking that's not a good number, 10%.
Well, that's true. So 10, 15%, so even bigger discount there of people who get that acute inflammation with hepatitis B. Again, their body won't completely get rid of it, and it'll take up residence in your liver, causing long-term low-grade liver inflammation.
So before you go on, so we got hepatitis C, which we have an idea how we can work to not get hepatitis C. How can we protect ourselves against hepatitis B?
So hepatitis B is generally transmitted through body fluids and blood. So again, dirty needles is a common reason. Unsafe sexual practices is another reason. Unprotected sex can potentially pass it on, and also particularly in China, for example, passage from the mother to the baby, either through the placenta or through breast milk, is another possibility. So what we call vertical transmission to the baby is quite a common thing. Fortunately, it's less of an issue these days because of programs of vaccination and checking for women and making sure that they don't have underlying hepatitis B.
Yeah, I mean that's an area that often comes to mind, not in talk about liver disease, but I'm thinking Africa and HIV, again, passing with mother to child. And this is an area that is, again, really important to think about with viruses and other things.
Yeah.
Getting passed to someone who has done nothing. they're just born, and that's, they just happen to have inherited something that is kind of nasty.
It is, absolutely. It's this kind of nasty thing. And, there are things that can be done if it's found, but with hepatitis B, prevention is definitely way, way better. So hepatitis B, hepatitis C worldwide are the most common reasons why people can get chronic liver disease and all the complications of that. And those viruses, they're particularly common in Africa, particularly sub-Saharan Africa. They're particularly common in East and Southeast Asia, somewhat common in Central and Central South America. Whereas in the Western world, and also I guess in the GCC, probably the more common reasons for getting chronic liver inflammation, in the West, alcohol's a common reason, and then fatty liver disease, which we mentioned earlier, because of those comorbidities, those diseases is associated with the blood pressure, the diabetes or the impaired glucose tolerance, the obesity, the elevated cholesterol. These are all common conditions in the West. They're common conditions here in the GCC. So these are maybe more common reasons why one might get a more chronic liver disease here.